Good morning, everyone, and welcome to this webinar from Institute for Exceptional Care about a national roadmap for disability inclusive healthcare. I just want to say how proud we are to finally present the product of over 2 years worth of work with an amazing network of partners and community members and other informants and experts without whom this would not have been possible. This work reflects not only the insights that we got from all of those contributors over the past 2 years, but also all of the previous pioneering work done by our sister disability organizations and healthcare partners who have been working tirelessly for years to try to improve how clinicians are prepared to serve this important and growing population of people with intellectual and or developmental disabilities. We could not have done it without standing on their shoulders, and many of them are in the room today. So I want to acknowledge, I won't get all of them gathered in, but I want to at least acknowledge the American Academy of Developmental Medicine and Dentistry, Special Olympics International, PATH PWIDD, Intellectability, Echo Autism, and so many others that come to mind. With that, I want to introduce your moderator for today. Lauren Erickson is Institute for Exceptional Care's Director of Policy and Programs. Lauren comes to us from a background first in human services work at the state level in Iowa, but then also as a national leader in healthcare policy, working at the Centers for Medicare and Medicaid, helping to drive some of the largest changes in how physicians have been paid in the last 30 years, and then leading primary care efforts at one of the nation's largest health insurers at Elevance. She comes to us for many reasons, bringing all those talents married with her personal lived experience as a sibling of an adult with IDD. And that really shines through. So with that, let me turn it over to you, Lauren.
Thank you for that very kind introduction, Mai. And thank you to all of you for tuning into the webinar this morning to discuss the National Roadmap for Disability Inclusive Healthcare. Before we get started and before I introduce our speakers, I'm going to begin the conversation by defining a few terms and acronyms that you will likely hear throughout our conversation this morning. So the first acronym I want to define for you all is IDD, which stands for intellectual and or developmental disabilities. These include autism, cerebral palsy, Down syndrome, intellectual disability, ADHD, and more rare conditions like Williams syndrome or Rett syndrome. ABC3 stands for Action to Build Clinical Confidence and Culture. ABC3 is a coalition led by IEC of people with lived experience with IDD and healthcare experts working together to scale strategies nationally to better prepare clinicians for serving people with IDD. This is the group of individuals and organizations who developed the roadmap that we'll be talking about this morning. And the third term you will hear pretty frequently throughout this conversation today is clinicians. We use this term to refer to individuals such as doctors, nurses, dentists, and other healthcare providers who provide healthcare to people with IDD. Okay, and one more bit of housekeeping before we introduce the panelists is this webinar is being recorded, and we will share that recording with you in our networks later this month. We also have live closed captionings enabled for the webinar. You can find those at the bottom of your Zoom screen by clicking on Show Captions. And we know the closed captions are not perfect, and the recording we share later will have more accessible features. And lastly, but not least important, is that as attendees, you have the opportunity to ask questions of our panelists today, which we will get to later in the webinar. You can type these questions anytime in the Q&A button at the bottom of the Zoom screen, and a member of our team will send those questions up to us. Okay, Now I'd like to introduce our three speakers. All three of them are members of our ABC3 steering group, and we're very excited to have them here today to discuss the roadmap in more detail. First, we have Dr. Craig Escudé. He is a board certified fellow of the American Academy of Family Physicians with over 20 years of experience providing medical care for people with IDD and complex medical conditions. He's currently the president at Intellectability, and he previously served as medical director of Hudspeth Regional Center in Mississippi. Craig is the author of Clinical Pearls in IDD Healthcare, as well as the developer of the Curriculum in IDD Healthcare, which is an e-learning course used to train clinicians on the fundamentals of healthcare for people with IDD. He received his MD from Louisiana State University School of Medicine in New Orleans. And secondly, joining us today, we have Dr. Dian Chin-Kip-Wells, who is the president-elect of the American Academy of Developmental Medicine and Dentistry. She has served as faculty in the Department of Pediatric and Community Dentistry for the University of Buffalo since 2000, and is also an attending pediatric dentist for the Pediatric Dentistry Specialty Training Program. Her work is centered on community dental education and advocacy. Dian holds a BS from Howard University and received her DDS from University at Buffalo School of Dental Medicine. In 2015, she received the UB Dental Alumni Association Humanitarian Award for her commitment to community education about the importance of oral health for young children. And our third speaker today is BJ Stasio. BJ is a disability rights advocate from Buffalo, New York. He is a member of the board of directors of the Self-Advocacy Association of New York State and has worked for the New York Office for People with Developmental Disabilities for over 20 years, where he works on person-centered planning, voting issues, and self-determination training and education. He's also a co-lead with IEC's IDD Advocate Corps and a member of the IEC Unity Council. He's a member of the Family, Individual, and Caregiver Advisory Board at Person-Centered Services and is a master trainer at Buffalo Racing, which is an organization that gets people with disabilities involved in 5K races. So as you can see, we have a great group of panelists to speak with us today about the roadmap. And so let's jump right into the conversation. Thank you all for being here with us this morning. And I want to start off by asking all of our panelists, let's talk about why we even need something like the roadmap in the first place. I would love to hear from you all. And BJ, we'll start with you, what you know from either your personal experience or what you've heard from others about what healthcare is like for people with IDD and clinicians who are serving people with IDD. So BJ, you want to start us off?
Sure, I'd be glad to. Well, if for me on a personal level, it can at times be an awesome experience finding out new things about myself and about the clinician or the medical staff who provide me services, or a nightmare. Like the biggest thing is probably the understanding of what the Americans with Disabilities allows as it relates to access. And I think about, for myself, when I was just getting over the bout with COVID, it was really frustrating when I had to have all those tests done to make sure the blood clots that I got from having COVID were gone and all that stuff. And I had went to see my doctor for a checkup, which seems like during that time I saw her a lot. And I held my anger in, and it actually came out in the waiting room in tears for me, which I never do because I was frustrated, not only about that, but it was probably a culmination of all the years of being denied the appropriate medical care and the respect I deserve as a patient. Forget about having a disability. I needed the hope, you know? So the hope was important. And for me, when I cried in my doctor's waiting room, she came to hug me. And while she hugged me, she said, "What can I do to help you?" I said, you can join me in IEC and make things better for everybody." That was my first thought. This roadmap gives me hope, but I need to remind everybody, yes, it's a roadmap. Yes, it's a guide to how to make things better, but we all have to take part in it. We all have to do our role to make it what it is. It's not just items on a paper, action items. The action items become action when we all do something with it.
Thank you for that, Craig. Dian?
Dian, you want to start?
Sure. So I will start by saying that I am a pediatric dentist, and I first specialized in adult dentistry, did a GPR in adult dentistry. I chose pediatric dentistry because, yes, I wanted to work with children, but it also was the only specialty in dentistry that included training to care for those with disabilities, including intellectual and developmental disabilities. And I have to admit, I was quite surprised knowing that such a large population of us have a disability, that we were not trained or did not see patients that were with a disability. And so, I had to sort out a specialty where that was. And pediatric dentistry, as we all know, there is an age limit. We are certainly working on adjusting that. When it comes to persons with disabilities, we can see adults with disabilities as well, too. But I needed my general practice residency program to really be able to be a comprehensive dentist for persons with disabilities. So I was very disappointed. And I wish that there was more training. And I very soon realized that wasn't just me. It was dentists internationally, and even, here in a country that's a first world country. So there are providers out there that do not feel trained and prepared to care for those with disabilities, even though we could be a person with a disability in 5 seconds, right? And this roadmap, just as BJ says, it's action. It gives hope. There are many other programs out there that are working towards preparing our providers, but this brings us all together and pretty much gives us the step-by-step what we need to do to become that competent practitioner to care for those with disabilities. And I'm really excited to be a part of that.
Great. Thanks, Dian.
So from my standpoint, I'm a family physician, and we're trained to, I think the phrase that we often hear is cradle to grave. We're trained to treat the healthcare, provide healthcare for people from all ages. But I sadly say that I was not trained to provide healthcare for people with intellectual and developmental disabilities. I fell into this world after I completed my residency and began working at a large state mental hospital and providing healthcare to people that were receiving mental health services there. And that was the first time I experienced really working with people with intellectual and developmental disabilities. There was this place, we called it, across the highway. That was a residential program for people with severe and profound levels of IDD and complex medical problems. And I heard that they needed some medical help. So I thought, well, I have a little bit of time. I'm going to go, see what I can do. And it took me about 5 minutes to learn that I really did not have the training that I needed to provide healthcare for people with IDD. I spent the next several years learning so much from the nurses who had been working there, the dentist who was working there, another physician who had worked there some, and from the people with IDD and their support staff about the needs, the healthcare needs of people with intellectual and developmental disabilities, about how people with IDD often communicate signs or symptoms of underlying medical problems differently than people without intellectual and developmental disabilities. And it was quite a humbling experience, I have to say. And unfortunately, I would say that this is a very, very common experience for most clinicians of any type, whether it's a physician, a dentist, a physical therapist, a speech language pathologist. We just don't have what we need in terms of training our clinicians. And that lit a fire under me, actually. After I realized, okay, I kind of figured this out a little bit, because one thing I will say, that it is doable. It's not that complex, to be honest with you. It doesn't require a complete revamping of all training programs. It just requires integrating a group of people that have been marginalized in terms of healthcare, that have many health disparities. It just requires incorporating that mindset and people with IDD into training programs. This is something that is very doable by every program that's out there right now. But that, like I said, lit a fire under me, and now I really my passion is to do what I can to improve training, to foster training, to develop training for healthcare providers and supporters of all different levels, and that is why I'm so excited to be a part of IEC. I've been a part for the couple of years that this has been going on, and to see this roadmap come to fruition and have it out there and available, and to help people to see that this is a process that is doable and we can achieve the goals that are in it, is very exciting to me.
Thanks everyone for those answers. And Craig, I love how you touched on not just you, but all three of you have actually been members of the ABC3 steering group since the very beginning of this coalition back in 2021. You all come from different backgrounds and experiences, which you've shared a little bit of today. And I would love to hear a little bit about how this coalition formed in the first place, and how all of you from different backgrounds, and maybe we'll start with you, Dian and Craig, were able to come together and determine that this work needed to happen.
Sure, I can start. So I always will remember that first email and phone call from Dr. Maifam. And she spoke about the IEC and all of the objectives. And, to me, it was, okay, where have you been? Have you been here all this time? And, just so super excited. She spoke my language in a way that could move mountains, that could make the change that's needed. And then bringing me into the meetings, I was just so impressed with all the attention to the details that every single one of us would need, as well as the number of self-advocates that were always present at every single meeting, and that their voices were most important. So I knew that we were working with an organization that was heading in the right direction. ABC3, I mean, just listen to the name. A stands for action. So many Zoom meetings and conferences and so on and so forth, but where is the action? And then about building confidence and looking at the culture. And, as you learn more about how this roadmap was put together, you'll see that those involved included not just the self-advocates, but clinicians who were persons with IDD, clinicians of color. I mean, attention was paid to each and every segment of the population that we deal with, which is just us human beings. So I really appreciated that.
Yeah, I would second that. I was, in the middle of my career, I guess I was really looking for resources and trying to learn more. And it wasn't that easy to find information about how to provide good health care for people with intellectual and developmental disabilities. And I found the American Academy of Developmental Medicine and Dentistry, which was great. And then over time, again, like you said, Dian, I saw an email from IEC, and I looked at the mission, and I was like, oh my gosh, this is incredible. I can't wait to talk to Mai and whoever else was involved with this. And so I jumped in right in the beginning, and it has been phenomenal. One of the things I've been most impressed with is the action. It's not just, hey, let's talk about this and hope things change. This organization is taking steps and doing things that will make a change. And that is something that I'm very honored to be able to be a part of and to be and just very excited about.
Well, thank you for the kind words. And BJ, you're involved with many advocacy organizations and many different efforts to improve healthcare for people with IDD. So can you talk about what makes ABC3 and the coalition unique from other groups that you work with?
Sure. And listening to the two stories of who people who I now consider family, because we work together outside of this, so I consider us family. How I got involved with IEC was a phone call from a board member who happens to be my mentor, Chester Finn. And when Chester Finn says, do something, you don't question. You're just like, okay, I'll do it. Because if you question Chester, that's a longer conversation than it needed to be. So I just, like everybody else, looked at the website, said, this is where I needed to be, because Chester knew all my medical issues that I was having with COVID and other stuff. He said, this is your opportunity to help move the wheels of change. So I wanted to take it. And the reason why ABC3 and all the other stuff that I'm on with IEC is important is the collection of advocates, as Dian said, because too often one voice for many organizations is enough, but this organization wants to hear from many voices, which myself as a state and national leader love, because I don't want to be doing this forever. Even though I am, I think I'll be doing it until my grave time comes. I realize that now, but that's okay, because I enjoy, speaking up and empowering people to do that. And we've all become family. We're all concerned about each other. We all want to know what's going on, and we all take pieces from one another's lives and bring it to our own. And I love this group, and you'll always be family to me.
Thank you, BJ.
We feel the same way, BJ.
Yes.
Yes. And we're so glad that you're part of this family too. So very, very happy to have you. And I think one of the interesting things that you've all sort of touched on in some of what you've said today is that the roadmap isn't just focused on developing new trainings. It's really about implementing trainings and creating change at scale. And there are many, many organizations out there that I mentioned at the beginning of the call who have developed really great trainings already. Intellectability is one of them. Craig, you represent them, and AADMD, Dian. Many others mentioned Special Olympics International, Echo Autism, the Alliance for Disability in Healthcare Education. There's been so much work out there already. And when, Dian, when did it become clear that the coalition needed to take this direction about creating this scale and an action plan?
When we're discussing healthcare for persons with disabilities, and we realize that there are so many barriers, starting with just even stigma and lack of awareness and lack of exposure to persons with disabilities. If you're not a brother, sister, mother, father to a person with a disability, you may not come in contact with such a large part of the population that is so, you can learn so much from, persons with, strength and determination, right? Sometimes is how we refer to the folks that we care so much about. And so learning about the barriers, listening to others talk about shutting the door. I think when patients approach me and say, I could not get my child's front tooth fixed so that he can have a fantastic smile because the dentist didn't think they can do it, or didn't think they had the time to do it, or felt that they would not be financially compensated for doing it, or most important and dear to my heart, that the provider did not want to do any harm. Do no harm is our motto in medicine and dentistry, right? And so if we have providers out there being trained, but not realizing that you can provide for all people, regardless one, and you will not do harm, at least try. I think that's when it occurred to me that this is so very important. It will bring us together from all the different groups, the AADMD, Intellectability, Special Olympics, bring us together with, one purpose, which is to make sure that these providers not just feel confident and competent, but excited about being a part of those who care for everyone, all abilities.
I think for me, one of the things that IEC and the ABC3 brings to the table is the coordination of the efforts of so many different groups. There are a lot of different groups that are working, as you mentioned, Lauren, in this space to improve healthcare accessibility for people with IDD. And I think IEC is looking at it from so many different aspects. They're looking at it from the clinician training standpoint, but then they're also looking at it from the accreditation standpoint and the other like professional society standpoint, and then looking at it from the payer standpoint and fostering a system that will appropriately pay clinicians to be able to provide good health care in this space as well too. And I think the value, one of the many values that I see with IEC is that coordinated effort and bringing so many different people that are working in different areas together towards the same goal.
Dovetailing on that a little bit, we there are so many of those organizations involved directly in the ABC3 coalition, but the coalition didn't create this roadmap in a vacuum or in a bubble on their own. So Craig, can you talk about how in the development of the roadmap, we included perspectives from other people?
Sure. One of the things that was very important and very valuable, I think, is the effort that was taken to hear from so many people, not just my story or Dian's story or BJ's story, but hundreds of people. IEC held focus groups looking at clinician groups. I participated specifically in the nursing group with the Developmental Disabilities Nurses Association, as well as the physician focus group at the American Academy of Developmental Medicine and Dentistry Conference. IEC brought in others such as clinicians of color, clinicians with autism, the Autistic Doctors International Society, clinicians with IDD, to hear the perspectives of many, many people, to really identify what were the challenges, what were the barriers that have brought us to where we are today, but also what were the motivating factors? And that was one thing that I really liked. What were the motivating factors for clinicians who went from not having an understanding of how to provide good health care to people with IDD to becoming competent and learning what that path looked like so that we can replicate it and we can use the things that we've learned from hundreds and hundreds of people in this space to be able to create a pathway that is doable, that is workable, that so many other people have already gone through. So what are the good points of that, and how can we get to clinicians who, like I was, not competent, didn't know what I was doing in this field, to a place where, okay, now these clinicians are comfortable and competent and can provide the same level of healthcare to people with IDD that they can to anyone else.
That makes a lot of sense. And so, learning all that information, and you touched on this a little bit earlier, I would love to hear, like, Dian, what made the learning all these factors, learning all this information, what made sectors like educational associations and professional societies, and then the accrediting and regulatory bodies, what made them float to the top as some of these the important things that we need to focus on as part of this roadmap?
Well, I think it goes back again to that word action. If you want to implement anything and have action, you have to make sure the accrediting bodies are on board. And, fortunately, other programs, again, such as the AADMD, we're working on policy changes and we're talking to those folks. And so it's so great to have the IEC and ABC3 and this framework to say, take a look here, this group is also working in that direction and can bring it together with an awareness and empathy that just has the most effective messaging that we need. So the different sectors are extremely important in making sure that we can actually put this into action. One hand doesn't clap without the other. If our professional societies aren't on board, then we're not going to be able to implement what needs to be done to care for those with disabilities. I think it was pretty intelligent to bring us together from all these different sectors, because I'm going to leave the meeting and go talk with my dental school. The dental school is going to let me know, well, CODA requirements say that we do have to prepare those with disabilities and to train for those with disabilities. And now you've given us a roadmap that can help us do that. I'm going to then go to an AADMD meeting and be able there to share the information that was learned there. And they're working with regulatory bodies for clinicians, and they can say, okay, yes, we can apply this. So, it just was the spreading of the information is not just amongst us on the committees. We take that out to these other sectors, and that's the only way we can have change that's sustainable, is my thought.
Yeah, I think that makes a lot of sense. And BJ, I'd love for you to hear your thoughts here. There's 4 sectors, the professional societies, educational associations, regulatory bodies, and accrediting bodies. But there's a 5th sector too, and that's the ABC3 Coalition itself and IEC and other advocates like us. So I'd love for you to talk about what role do you see, advocates playing in this roadmap?
Let me tell all the advocates who I hope are watching this today or who will see the recording, we finally have our seat at that table we've been longing for so long. So don't waste it. When a clinician asks you a question, offer your answer, because that's your seat at the table. Even though you weren't physically a part of this developing the roadmap, you can still think about the action items and say, gee, I would like to know more about that and understand it. And as I was reflecting on what I was going to say today, and Dian, I'm sure will smile at this, I was thinking about my friend Judy today. And when she made her speech during the sit-in for 504, she said, don't nod your head and act like you're listening, but listen and actually understand what I'm saying. And that stuck with me today. That's what IEC has done with all the advocates I've talked to who have been a part of it and will be a part of it. It's their opportunity to be heard, and their voice is being listened to. And that does my heart good as an advocate to know there's finally a group that will do that. It took forever, but we're finally here. And don't blow your opportunity when people want to listen to you.
Thanks, DJ. I'm going to take a quick pause and just remind attendees to put questions in the chat or in the comments. I can see a couple coming in. I have one more question for our panelists, and then we'll start taking questions from the audience. So send in those questions if you haven't already. I would like to ask everyone to talk about, what the next steps are for the ABC3 Coalition. And if you'll indulge me for a couple seconds, I can talk about a little bit about what IEC is doing, as we're working towards our plans for this year. We have started, the first phase of the roadmap is really building culture change. And we see that as a predecessor for all the other things that need to happen to kind of soften the ground for the rest of the roadmap. So we've started working on a couple projects this year with partners such as Ability Central and Delta Dental Foundation of Michigan and Delta Dental Foundation of New Jersey, where we're working on improving the experience of care in dental settings for people with communication challenges, which is pretty prevalent within the IDD population. And so IEC is very excited to continue working on those projects, and several of the panelists are involved in those projects as well. But I would love to hear from you, broadly, what you think the next steps are for the ABC3 Coalition in the roadmap.
I'll start with that. I think it really is ensuring that the roadmap is out there, that people really understand it, see it, need it, see it, and grasp what it means. But more than that, it's that we work together to implement these steps that are so well outlined in the roadmap, that we need to work on all of these different areas and foster and encourage others to work with us and to use the roadmap on their own to work in their own areas and own space as well too. I know for me, my kind of specific focus is really clinical skill building, not just what I call cultural competency. That is very important, but I like to focus on teaching clinicians clinical and diagnostic skills to improve healthcare for people with intellectual and developmental disabilities. What questions to ask? What are the right things to? How do you get information? What is the information that you need? What are the most common health conditions that we see in people with various different conditions, and why, and how do we recognize and better provide better health care in general. That's one of my little pieces that I'm going to focus on. And I know that we all have our pieces, and that the roadmap is something that I think we can all look at and use in our own work to continue to move forward to a place which is what I kind of call my little mantra or goal standard. It's where anyone with or without a disability or any level of disability can present to any clinician's office or hospital or dental office and receive a basic level of competent and compassionate health care. That's what we need to be doing, and that's what we need to be working towards.
And I would add, continue to spread your wings, our wings, which is exactly what Craig said. But that could include collaboration with other allied health providers out there. So I know what has been successful for me has been working with occupational therapy and combining my dental appointments for my patients with an OT. And so I think taking a look at other allied health providers out there and trying to figure out, are there others that we can talk to, tap into, and bring into this coalition. Mm-hmm. I also believe that we can continue to learn a lot from our self-advocates and reach out to others. I mean, it certainly is helping me to be more self-aware as I go through this process. And I think it's a huge advantage. Continue to have IDD-focused events at professional society meetings and, come to conferences and more of exactly what we're doing here right now. I was so concerned, like, what am I going to be able to say? Because all I want to say is just be a human being and care for, other human beings. That's why we're placed on this earth. And if you're worried about how you're going to do that, okay, well, here's a roadmap. And it starts really with relationship building and understanding people. And it's really interesting that we actually have to have a roadmap for that. But, IEC ABC 3 has done this in a really high functioning way. And I am on board. And I think we just have to do more of what we're doing and make sure that we are collaborating with others out there.
BJ, how about you?
Well, for me, it's share it, talk about it. Whenever I get an opportunity now, I'm going to talk about it. But with me talking about it, I'm going to take some action items. I'm going to talk to more clinicians. I'm going to talk to more dentists, because up until I had the dental issue, I didn't realize how important all that dental preparation was. So I'm going to talk to more dentists about what I need. I'm going to talk to more clinicians. And these are action items, but action items don't happen without all of us taking action. Other than that, it's just going to be words on a paper. It's going to look nice. It's going to sound nice. But our time to take action is now, not yesterday, not tomorrow, not next week, now. Because I, as a person with disability, have waited long enough for things to change. And I always believe in being a change agent. And I am with a group of change agents. So let's make change, people.
Thanks, BJ. Okay, so now we're going to take a few questions that we've gotten from the audience. Thank you, everyone, for sending them in. And the first one is from Canada Developmental Disabilities Primary Care Program of Surrey Place. So, what was the key factor for success in establishing the IEC and ABC3 coalition?
I would say one of the things is the leadership and the drive and the persistence to make a difference. We've probably all been involved with things that we were like, this would be great if we just did this or we just did that. And then we talk about it and then it kind of just fizzles away. But the key to success here is really, I would go back to Dr. Pham, to Mai, and the team that she has put together, and the drive and the desire and the passion with the leadership here that is making this work.
Yeah, I absolutely agree. And I will say highly effective communication as well. Wait till you get an email from this group. Just a simple email will start with, in this email, you will learn, and so we're so busy, right? I mean, I have patients waiting out there. We're busy people. And so when you receive an email or some method of communication that gets right to the point, that's so appreciated. And I think so much more is accomplished that way. So yeah, for me, a key factor was its high level of communication, effective communication.
Thank you.
For me, it was the want to create change, because you have to want to create change. And IEC as a group and as a family wants to create change, not just sit and talk about it and smile and go on about our lives. We want to create change.
Yep, that makes sense. And that's why we pulled all of you in as well, because we know that you're the partners we need to do this. And Dian, I'm glad you find our emails easy to read. That makes me very happy. Okay, the second question from the audience, let me find it here. So there have actually been several questions about advocacy and how people can support the roadmap. So how can groups take this roadmap and put it into action? Are there advocacy opportunities to support this work, or what all would you recommend?
Well, I think for me, being a part of the AADMD, and we have student chapters and resident chapters, and also being on faculty at a dental school and just a clinician itself, I can use this roadmap in so many different ways, starting with the students and the residents. And again, giving them that foundation so early on before they actually start seeing patients is so important. Instead of coming into it all not blind, but not having a clear vision of what you need to care for those with disabilities. Because of this roadmap, we have a clear vision that we can share. And this is a vision not just put together by your instructor, but involved a coalition of folks that care, really have the empathy for it. So I think taking it and placing it into every aspect that I am a part of as a clinician, as a teacher, and as part of an organization like the AADMD.
Well, for me, it's just whenever you have an opportunity, contact somebody at IEC to talk about it. We'll come. Any of us will come and talk about it, talk about our experience, because the only way change is going to happen if we continue the dialogue. The dialogue doesn't stop here. It needs to continue. It needs to have a groundswell of support around the nation, not only with advocates, but with our elected officials, the policymakers, the people to create change in our state, in our local, and our federal government. That's where everything needs to happen.
Every person on this call, every person who's watching this has connections with someone that they can take this roadmap to. We all seek healthcare from clinicians. We all work with a dentist or a healthcare provider. That you can share this with your own healthcare providers. Many of us know legislators or people in organizations that have or people in medical schools or health professional schools. We have friends that you can take this roadmap to and share with them. So think about people in your world, in your life, that you have a connection with, that you can share this roadmap with, that you can share IEC's vision and mission, and they can be encouraged to be a part of it.
Thanks, everyone. I would also add, those are great things you can do. I'll add a couple kind of discrete roadmap focused things you could do. So we have the roadmap. You can explore it more in depth by visiting inclusivecareroadmap.com. I believe that link was sent out in the chat of this conversation. And while you're exploring, you can join us in championing the roadmap itself by adding your name as a supporter. That's one small tangible way that you can show alignment with this vision. And the more people we have aligning with the vision, the bigger that vision becomes. And if you just go to that website I mentioned, you'll just see a link there. And please, you can stay in touch with the IEC. Please feel free, if you like. You can reach out to me directly. You can put my email address in the chat if you like. It's Erickson@ie-care.org, and feel free to reach out to us, and we'll figure out how to get you involved with the future work of the roadmap. So there are plenty of ways to stay involved. So we'll go to the third question that we're getting from the audience, which is we have a couple questions around how to ensure clinicians are required to learn about IDD and allowed to implement new standards. And how do we enforce the standard of care in the actual care environment? So I'd love to hear from you all about that.
Well, could you have asked a more complex question?
just a light one to end the conversation.
Yeah. It starts with a drive and a change in the person or the person to see the need for change themselves. But I think that there are other opportunities to foster change in terms of looking for different avenues to incorporate the need to teach this information. So what I'm getting at here is, let's say we're creating a test for, family physicians. Why don't the people who create the test maybe ask a question about a person with an intellectual disability? If we're looking at an accrediting body or a board certification body, maybe they could begin to incorporate questions related to intellectual and developmental disability healthcare into those board exams, because I think that would help foster or at least raise awareness that schools and health professional programs need to be teaching this information, and would encourage them to teach it, to bring that into the curriculum. So that's one thought that I have, and there are lots of others, but I'll turn it over to someone else to add to that.
Yeah, I can add that you have to be at the table. You have to be really intentional about being at the table, whether that is curriculum change. So, you be at your dental school or at your medical school, be involved. I now really think through the positions I'm asked to take, because if it can allow me to advocate for this framework, for the AADMD, for work to advance care for those with intellectual and developmental disabilities, then I'm going to say yes. Even if I'm busy, I'm going to say yes. Program director, yes. Be part of, competencies, yes. Be part of curriculum, yes. So that I can assure that this is not forgotten, that it is continuing to be an action item. So really being intentional about positions that you're asked to be a part of and be at that table so that you can broaden where that change is being made.
That sounds great. It's, no small task, but I'm really glad that we're all talking about how to move forward in this next phase of work. And the last question I'll ask, as we're running to the end of the time here, is, we're getting a lot of questions about reimbursement from private payers as well as Medicare and Medicaid. The need to make sure clinicians are, compensated for the work that they do. And I will just before turning it over to the panelists, I'll say that there are some payers out there who have begun taking steps. I mentioned the Delta Dental Foundation of Michigan. IEC is partnering with them in developing some curricula and toolkits around how to make dental practices more inclusive for people with communication disabilities. Delta Dental Michigan, they've actually started a differential benefit, dental benefit for people with IDD that allows for things like longer visits, visits to the dentist's office to get acclimated to the office. And that has actually started being adopted by other Delta Dentals out there. So there are things that payers can do. They're also involved in this work as well. Craig, Dian, BJ, I'd love to hear from you if there are steps you're taking or things that you think we could do to continue to work with payers and how they look at reimbursement. If you'll indulge me one more thing before I turn you over, I will say that's another thing that IEC is working on in several of our other projects that we're very focused on is working with payers. Like my background is in payment and finance arena. And so I'm not going to sidetrack from the roadmap today, but would be happy to talk about those payment and reimbursement opportunities in more detail in another conversation. But Dian, Craig, BJ, what do you have to say about that?
I certainly want to echo the accolades for Delta Dental Michigan. They have expanded their dental benefits in some states, and we really are hoping that we can expand that to other states as well, too. Dental school, like medical school, is extremely expensive. Folks want to be compensated for the work that they do. I can't have everybody just do everything out of the generosity of their heart, even though that's how I wish it really was. Mm-hmm. And work is being done to work with insurance companies, private sector, public sector. There was a National Council on Disabilities Medicaid report that was put out. And, we dentists were surveyed. Why are we providing care and why are we not? And of course, finances come up all of the time, correct? And so, yes, it's good, again, to be able to take even this framework to the insurance companies and say, this is how we're preparing the providers, but we need to assure that there's funding and that persons with disabilities can get the care that they needed, and that's funded for as well, too. So, it's a very, very important piece of providing care. And I wish it wasn't that way, but unfortunately, that is the way it has to be. So we need to continue the work with the insurance companies.
Preventive healthcare saves lives. It improves lives, mm-hmm. but it also saves dollars. And many, insurance organizations, companies, they have to, again, pay their staff and make a living as well, too. And understanding that providing training, providing opportunities for everyone to get the healthcare that they need, including preventive healthcare, will not only improve the health of the population, but it will also reduce healthcare costs. And I think that is an aspect that we need to bring to the conversation and ensure that that's part of the conversation when we're working with payers to help them understand that when we provide this, when clinicians are better trained to provide better health care, you're going to have better health outcomes, which will in turn result in less hospitalizations that are unnecessary or preventable, and certainly deaths as well, too. And investing in this space is valuable, not just to people's lives, but also to the financial health of our payer system as well.
I think for me, I would love to sit and talk to those insurance payers, because when they see the documents about us, that's all they see. That's our history. They don't see the life situation we're living in that moment. So they make the judgments off what they read. And the only way you're going to see the whole book is by opening the book and understanding the whole situation, not just the cover. Because the cover doesn't cover the whole person, the whole book does.
That's a great point, PJ.
Can I add one take-home message is that we need to document better as clinicians as well too, so that the insurance companies have data to go by. So, write that information and use those codes and document. It's going to be a very important part as we talk to insurance companies.
Well, thank you, everyone. I'm going to start wrapping up as we have just a few minutes left in our time. So I want to start by just thanking all three of you for joining the conversation today. BJ, Dian, and Craig, thank you so much for sharing your experience and for working with us to develop the roadmap. We are so, so grateful for each of your leadership within the ABC3 Coalition and for all that you do beyond ABC3 as well. We are so thankful that you spend your time with us and with this initiative and with us today as well in this conversation.
Well, it's a wonderful opportunity, and thank you back. I appreciate it.
Yes, thank you.
Thanks, Greg. A lot of love happening in this conversation today. So as we wrap it up, I want to remind everyone that today's conversation was recorded, and we will be sharing this conversation later, the link to the recording later this month. So make sure you are signed up for IEC's emails to get that link. I would also like to thank everyone who joined us for the conversation today. The roadmap is an ambitious blueprint, and it can only be successful with the buy-in of both the healthcare and the disability communities, and by taking those actions that all of our speakers talked about today. Our speakers all mentioned examples of how groups are already putting the roadmap into action and ways you can begin to promote this in your community. So if you're interested, you can explore the roadmap more in depth by visiting inclusivecareroadmap.org. And I mentioned previously on that website, you can join us in championing the roadmap for the National Roadmap for Disability Inclusive Healthcare by adding your name as a supporter. There will be a link on the website. And we look forward to sharing more updates with you through our newsletter, our website, and more events like these. Please stay connected. And we thank you all for spending the time with us to talk about the roadmap this morning. Thanks, everyone.